interosseous sacroiliac ligament attaches to the tuberosity. Okay, then we've also got an arcuate line. Now this, remember, is the iliac fossa. Just inferior to it is the arcuate line here. So the line is kind of between the iliac fossa and then the body of the ischium, which is down here. So there's the arcuate line. Now if we turn the specimen over and have a look at the gluteal surface, so the posterior aspect, what we'll try and do is find some gluteal lines. Now they're reasonably tricky to find. On this specimen I'm hoping we'll be able to spot them. So what you've got is there should be an inferior gluteal line just here, and it is pretty tricky to see on this one, I'm sorry, but it usually is. So unfortunately you need to get used to that. The inferior gluteal line can be hard to spot, but the anterior gluteal line is as good on this one as it is on any of them really. It starts here about where the tubercle of the iliac crest is, and it runs around here. Now on this specimen there are a couple of bumps and ridges that make up the line, and I can certainly feel them with my thumb, and if it just catches the light right, you can see there's a few ridges just here. That's it there. So just realise that they're pretty tricky to spot. They're usually completely absent on the plastic models, and sometimes can be hard to spot even on the specimens. The posterior gluteal line's quite nice on this one though. Here it is here. So there's the posterior gluteal line there. So we've got inferior, anterior, posterior. And on the skeleton that's got the muscle attachments painted on, you'll see that that anterior line is in between the attachment points for gluteus minimus and medius. So that's a good one to look at. That's kind of helpful. It lets you know at least where that line is. Okay. So, and then of course the anterior and posterior ones are at the edges too of medius and minimus where they attach. All right. So good luck. Have fun finding those ones. They're a little tricky, but don't forget, if I want to pin them in an exam, I have to use a specimen where you can actually see them. So I have to find one. Then if we move on to, oh no, there's one more, sorry. The greater sciatic notch. So from this point of view, the greater sciatic notch is this great big notch here. It's just in between the PIIS and the ischial spine. So this is the greater sciatic notch here. Now then from there, we can move on to the ischium. And from this point of view, a fairly posterior point of view, the body of the ischium is here, but we can also see it from a medial point of view here, and a very lateral point of view, we can see it here just below the acetabulum. So that's the body of the ischium. And then of course we have an ischial tuberosity where the hamstrings attach. And superior to that, on the medial surface, we have an ischial spine. And that's a nice one. Often they're broken on the real bones, but that's quite a nice one. And then we've got the ramus of the ischium, which I've already mentioned previously, just this bit here coming off the body, so this part here. And then we've got the lesser sciatic notch. So the lesser sciatic notch is here, it's inferior to the ischial spine. So we had the greater sciatic notch above the spine, lesser is below or inferior to the spine. Now on the pubis, oh, and I wanted to mention too, don't forget, if we drew a line across here like this, from the acetabulum down through that ischiopubic ramus, everything in front of that line would be pubis, everything posterior to that line would be ischium. Okay? Remember, of course, that line there would be telling us where the ilium is above. So, ischium all here, pubis all here, so we've got a superior pubic ramus, a body of the pubis, an inferior pubic ramus, and then if we turn over to look at the medial aspect here we've got the symphyseal surface, so this surface is going to come and join with the interpubic disc. So that's the symphyseal surface. On the front here we have the pubic tubercle, that bump there that's quite easy to palpate. So there's the pubic tubercle, and from the tubercle to the symphyseal surface there should be a crest. So there should be a ridge that runs along here onto this or to the symphyseal surface. Now sometimes the specimens, the real bones are a little bit damaged, and you can't always, sometimes the crest is just broken and not really there. On this one it's not too bad, and there is a little bit of a ridge there that you can see. Again, if I want to ask that in an exam, I've got to find one where you can actually see it. And in that case, sometimes the plastic models are not bad. So that would be the pubic crest there. Now then on the medial surface here, remember this line here was the arcuate line. The continuation of the arcuate line here on the pubis is the pecten pubis. So that's it there. Usually it's quite a sharp line. On this one it's a little bit rounded, but often it's quite a sharp line and quite easy to see. So there's the pecten pubis on the superior ramus, and it's continuous with that arcuate line that's on the ilium. So pecten pubis just here. Okay, and that's it for the bones.